Hello everyone, happy October. Today's town hall we are focusing on our Aurora CBOC as well as our Hines main campus. I'd like to share some information about our main hospital, including commonly requested phone numbers, which is on your screen now. Today's Veteran Town Hall is also highlighting our Aurora CBOC, which provides many services for area veterans, including laboratory, pathology, mental health, pharmacy, and primary care. In fiscal year 2025, 6,400 veterans were seen for face-to-face primary care appointments at our Aurora CBOC. As of September 29th, Aurora is the first of Hines CBOCs to pilot a low-risk nail clinic initiative. Veterans who meet the requirements can now be scheduled to have their toenails cut at the Aurora CBOC. This change frees up clinic appointments, allowing patients who need more extensive podiatry care to see specialists at Hines much sooner. Additionally, our Aurora CBOC added a new provider to assist with improving access to care and a veterans VSO on site on Mondays to help veterans with claims and other benefits. You can find the Aurora CBOC contact information on your screen. If you have any specific questions for Aurora or Hines, please comment below or send us a Facebook message and we'll get back to you as soon as possible. All right, we're going to kick off the rest of our town hall as we do all our town halls here with a safety story. And I'd like to invite up one of our HRO leads, Mr. Beck.
Thank you, Director Doling, for that. Good evening, everyone. Our safety story today is about a veteran who was seen in the outpatient clinic located in Hines Building 217. In the past, if a veteran needed an assistive walking device or wheelchair to be issued to them, the provider would generate a consult for equipment, and the veteran would then have to report to the physical medicine and rehabilitation clinic located in Building 228. This process had been seen time-consuming and often required the veteran to do a lot of running around and served as a barrier to the veteran getting the needed equipment. The kinesiotherapists who worked with the veteran coordinated with the outpatient clinic team to streamline this process by stocking up on assistive devices and have the consults directed to their clinic. This allowed the equipment to be issued to the veteran at their point of service with the provider. This is now a one-stop process for the veteran. Today, veterans can get their assistive devices on the spot without having to drive to another building. This saves a lot of time, eliminating the need for the veteran to find another building, look for parking, walk into the building, find the location in which to report, check in, wait, and then get back to their car. The new process eliminated steps that were found to be excessive, unnecessary, and previously left veterans feeling overwhelmed and at times resulted in veterans leaving without getting their equipment. This implementation is patient-centered, exemplified the high reliability value of It's About the Veteran, while also improving overall veteran safety. This concludes our safety story. I will now introduce Dr. Richardson for medical updates. Thank you.
Thank you very much. And for the medical update today, I want to remind everyone a couple of things. The first, obviously, this is vaccination season. The CDC and FDA have come out with the recommendations for influenza vaccine. And still, as always, adults between the ages of 18 and 65, including pregnant women, are recommended to have our influenza vaccine. It's a trivalent vaccine at the moment with 2 influenza A and 1 influenza B in that vaccine. It's recommended that adults over the age of 65 consider the high dose vaccine and recommended. It's considered also that anyone with an egg allergy can have the influenza vaccine without any specific concerns or any specific recommendations, because the vaccines now are having no adverse effects with people who have egg allergies. September, October is now the prime time for one can have your influenza vaccine. and certainly it can continue on. It takes approximately 10 to 20 days for your immune system to work. So therefore, the earlier you get the vaccine, the immunization, the better it is for your protection during the season. And last of all, to remember that the purpose of getting influenza immunization is that it decreases your chances of having a respiratory illness, but it also decreases your chances also of having hospitalization if you do get the illness. And that is most important, particularly for the elderly. You will hear a little later about the clinic dates and the clinic times that you can get your immunization. Second thing I wanted to give you an update on is to remind you that we have continued in this year to increase the access available in your clinics. You know that we have some Saturday hours in various CBOCs at each Saturday a different CBOC for the month. And also we are increasing our access by increasing the availability and the use of our telehealth services. And therefore patients who sometimes may have difficulty getting into certain clinics for some after discharge from a hospital are going to be hooked up and are going to be offered or expanded telehealth services as well. So these are some of the two things that I wanted to bring up today. And now I'm going to hand over to Ms. Candice Kent for our patient advocate.
Thank you, Dr. Richardson, and good evening, everyone. My name is Candice Kent, Veteran Experience Officer here at Hines VA. Next slide. So as you all know, our fiscal year begins October 1st for Hines VA and much of the federal sector. So I want to take this time to really highlight all the amazing things done here at Hines VA, keeping you in mind, our veteran. Next slide. So as you always know, we're always listening here at Hines. So whether it was V-Signals, our SHUP survey, or patient advocate office, you made your voice heard and we listened to you. Next slide. So our V-Signal survey, we had over 15,000 surveys completed here at Hines VA with over 6,000 comments with each of those surveys. So thank you for your feedback. We greatly appreciate it. We use that feedback to improve services here at Hines VA and enhance your experience. Next slide. And when it came to our SHUP surveys, what type of comments you are leaving? The comments majority centered around compliments here at Hines VA. As you can see, almost 80% of the V-Signals comments centered around how good we were doing and how you liked your care. The other 20% centered around concerns and recommendations here at Hines VA, and we use that information again to enhance your care here at Hines VA. Next slide. And when it came to our SHUP survey, we had over 1,000 primary care responses, over 800 inpatient, and 1,200 plus specialty care responses. Again, using that feedback to really enhance your care here at Hines VA and also improve services. Next slide. And then it came to our patient advocate office. You came and you spoke with us. Over 7,000 requests were had here at Hines VA regarding our patient advocate office services and getting the support you needed. 1,000 of those requests centered on compliments. When it came to resolution, we took about 2 days to provide resolution to your concerns, and over 95% of you were satisfied with your resolution. Next slide. And then our trust score. When it comes to Hines VA, 94.5% of you trust Hines VA to get your care here, and we thank you for that. Next slide. And then enhancing veteran experience. In FY25, we did a lot to improve care and to ensure you had a great experience when getting care here at Hines VA. Next slide. We opened our Veteran Resource Center, ensuring that you had access to our patient advocates, the Veteran Library, and also the variety of resources offered here at Hines VA. And we are open from 8 a.m. to 3 p.m. in Building 1, F155. Next slide. And then patient feedback, again, that matters to us. So we opened the doors and created more access for ways to give feedback. We had comment boxes placed throughout the facility to ensure that every veteran had a voice here at Hines VA, even when you didn't get a survey. Next slide. And then charging stations, we put them throughout the facility, again, recognizing how important your electronic devices are to you. We had our charging stations placed throughout the facility to ensure you were able to access and charge your devices when needed. Next slide. And then, of course, parking. We expanded it here at Hines VA. We're very intentional about ensuring we have parking spaces for our patients to ensure you are able to access care in a more easier way. As we recognize navigating our facility can be hard at times, very challenging. It is a big facility. So parking became our focus. We heard your voices and we began to work steady on that in FY25 and made great improvements in that area. Next slide. And then also we celebrated here at Hines. FY25, we had a lot of milestones, a lot of great things happening here at Hines VA, and we worked with you and collaborated with you to celebrate those moments here at Hines VA. Next slide. We had Red Fridays. We dressed in red every Friday in solidarity with our veterans our active service members who are deployed currently, kind of recognizing the next generation of veterans and standing in solidarity to support them. Next slide. And then PX Week 2025. We celebrated you all for choosing Hines VA, all the amazing work we have done here with you all over the past year, and really thank you for choosing Hines VA. Next slide. And then our Starfish Award. Not only did we celebrate you in 2025, you celebrated us. We recognize our amazing staff for the work they do here, the collaboration and support they provide to you, and you complimented them, and we recognize their work and expertise here at Hines VA. Next slide. And that's all I have for you. My name is Candace Kent, the Veteran Experience Officer here at Hines VA, and next I have Brad Lomax with Telehealth Services.
Thank you, Ms. Kent, and hello, everyone. I just want to start by saying I'm so excited to be here to share with you the virtual care options at Hines and how we are expanding to provide care where you are. Next slide. So virtual care means getting care from your VA team without always having to drive to Hines or another medical center. So you can use things like secure video visits, home monitoring tools, virtual check-ins, and digital messaging to connect with your providers from home, your local CBOC, or wherever is easiest for you. So this can help you get faster access to care, stay connected between appointments, manage your health more conveniently and safely from your own home. So one option is to have a clinical telehealth visit. So this allows you to meet with your VA specialist through secure video visits without having to travel too far. These appointments are available at your closest CBOC. During a visit, one of our amazing telehealth nurses help place you in your appointment room where your provider will be waiting on a video screen. They can assist with things like checking your vitals, reviewing some symptoms, performing assessments under your supervision of your provider, using digital tools like stethoscopes, otoscopes, and EKG devices. Next slide. Another option is called Store and Forward. So this allows clinical images and test results securely performed by a telehealth nurse sent to your VA specialist at another time for review, saving you having to travel and saving you time. Examples include teleretinal images for diabetes-related eye exams, telederm for skin concerns, and telespirometry for lung conditions like COPD. And so on the top of your screen is our teleretinal machine, and on the bottom of the screen is our telespirometry machine that we would use with you. You can use these at your CBOC or even from home using My VA Images for some instances. Next slide. So home telehealth helps you stay connected with your VA care team between appointments without leaving your home. Once enrolled, you'll receive easy-to-use devices like a blood pressure cuff, a pulse oximeter, a scale, or other equipment. A nurse will check your reading daily and reach out if anything looks concerning. They'll also call and contact you regularly to ask how you're doing, adjust your care plans, and help with medications, or help you with follow-up appointments. So why this helps? It helps detect problems early before they become emergencies, reduce hospital admissions and emergency room visits, allows you to leave the hospital sooner, and supports a better recovery at home with daily check-ins. Next slide. So this is just an example of some of the home telehealth equipment that you receive. Usually once you're enrolled in the program, you'll receive this equipment within 48 hours to 72 hours. And one of our telehealth specialists will work with you to make sure that you know how to use it and it's easier for you to use as needed. Next slide. And finally, Hines Virtual Care. uses all of our telehealth tools we have discussed and more to bring your care team closer to you. So this lets your team check on your health, catch issues early, and reduce hospital visits. So how do you get started using virtual care? Talk to your VA care team, ask about your virtual care options. You can get set up on some of these applications using your own device or requesting a VA loan tablet. You want to stay connected, you can use My VA, VA Vet, which is our patient portal, Annie, and also VA Video Connect with your provider to message your team, check vitals, and attend visits. So thank you for your time listening, and next I'll be introducing our Chief of Engineering, Joe Tumpus.
Hello listeners, my name is Joseph Tumpus. I am the Chief of Engineering here and help manage the facilities and all the infrastructure around the campus. I'm going to talk a little bit about the EHRM project that we have going on, and even though that's a common term around here for all of us working at Hines, for those just tuning in, that's the Electronic Health Record Modernization effort. And that's a kind of a two-part effort where you have the actual software that the clinicians are going to be using, but with every good software you need a facility and the infrastructure to support it, and that's where I come in and that's where my team comes in. So as an overview, this implementation, as you can see on the screen, these slides, I'm going to warn you, some of them are pretty dense with information. I recommend feeling free to reference back to them at any point. I'm going to kind of just go over the higher level details on them. But this infrastructure modernization that we're taking on is going to be a multi-year project, and it's going to bring the entire station along with the C-Box up into compliance with really state-of-the-art networking and communication standards. Next slide. Now some of the background of what we've been doing. Now, like I said, it's a multi-year project. We've already completed a number of the projects at the C-Box. So there you can see highlighted in green are the areas that we've already completed the work. We do have a couple that are very close, but those should be wrapping up in the next couple of months. And then we have the main campus here at Hines that is still going to take a good couple of years before we're completely wrapped up. Next slide. Now about this project. So this has been designed and the contract for construction has been awarded. Now we're in the first phase of the on-campus Hines work. There's going to be three main components where you have our exterior work, we have our interior work, and then in the interior side it's kind of broken into two sections where you have the cabling and then the kind of heart of the system or the actual data center rooms. So all of this is going to touch every corner of our campus, and if you go to the next slide, you'll see for the exterior work we're working on putting in brand new fiber optic cabling. This is going to establish the high-speed communications that we need with the outside world. There's going to be a lot of trenching involved with this. That means you're going to see trucks that are doing digging. There's going to be a lot of trucks that are really loud and they look like giant vacuums, and that's exactly what they are. They suck up the dirt, and it's a way of digging so that you don't disturb any of the other things around you. We're going to have those all across campus for the next several months as they work to set up the new fiber network. Next slide. Here you can see where some of it's a little hard to see, but around the little red bubbles is where you can see the extent of the current fiber work going on, kind of right in the middle of campus and then all along the south side. Next slide. Now once we're getting into the interior work, we're setting up 76 new telerooms. So these are the kind of satellite stations that work as branches for all of the computers to hook up to. Any data cable, any network cable has to be pulled back to one of these telerooms. We're setting up 76 new ones so that they're fully in compliance with all the requirements of a modern teleroom. Next slide. With this work, we have multiple crews and multiple sequences. This is kind of a high-level view of it, but you can see we're going to be in multiple buildings, and there's a lot of different phasing going on. Next slide. And again, I'm not going to get into all the details of the slide, but the key is going to be that the key to this interior infrastructure work is that these Cat 6 cables, they're going to be in and around all of the clinic rooms, all of your offices, down the hallways. So it'll be expected that there'll be some disruption from that construction. Next slide. Here's some other crews and some of the other work that they're doing on the infrastructure and the dates that go along with that work. Next slide. So how is this going to impact you while the construction is going on? Well, we've gone through a lot of design efforts to make sure that the existing network will stay in place and all the existing features are going to be up and operational the whole time. Meanwhile, we're going to be working all around you. We have a lot of different construction barriers that are going to be set up. We have a lot of different designs that have set up so that we can do this work alongside your normal care. But with all good plans, there are some things we may not be expecting or something that doesn't go as we planned. So please be patient with us. Please be flexible when it comes to things like a little bit of noise or maybe some disruptions to your normal path as you come to take your appointments. Next slide. My main team here is this project is being led by the leaders of our project planning department, Larry Doyle and Rich Frater, and we have our 3 engineers that are going to be deep into this project, Brandon Sidler, Javier Martinez, and Victoria Brooks, and they are deep into the project, like I said, very involved and ready to help make this a smooth and fast transition. Next slide. All these pieces of the work are going to be happening at the same time. Some will start and stop at different phases, but you can expect that this kind of work will be happening for the next couple of years. Our service chiefs will be doing a lot of the coordination amongst the construction teams and how it impacts their clinics. But please feel free to bring up any concerns that you may have. Next slide. And next slide. And next we will have Jake to speak about some more on flu vaccinations. Thank you.
Good evening, I'm Jake Plesick. I am the Chief Nurse of Ambulatory Care, and I am also the flu facilitator here at Hines. So I'm here today to talk to you about your opportunity to come get your flu shot with my team here at the Hines VA. So, as Dr. Richardson mentioned before, it is now flu season, and we are here to offer those flu shots for you at any of our outpatient locations. So, if you are out at the CBOC out at Aurora, you can walk in at any time and get your flu shot during our normal business hours. My nurses would be happy to come see you and to address those needs as you come in. If you have a scheduled appointment, please don't work out of your way to come and see us. You can get your flu shot at your regularly scheduled appointment as well with your primary care provider, and my nurses and during that visit will offer you that shot. If you're here at Hines and you will get your care here, you can get it in Pack C down here in Building 1 in Room 1E105, on the 3rd floor and the 10th floor at our regular primary care clinics, on the women's clinic, or on the 12th floor. In Building 228 on the 3rd floor as well. Any of those clinics are all walk-in appointments. You can come see your primary care team and we'd be happy to give you your shots. If you have a medical subspecialty appointment, so if you're in cardiology, endocrinology, or any of those on the 4th floor, if you have a scheduled appointment with those clinics, my nurses would be happy to offer you a flu shot at that clinic as well. That clinic does not take walk-ins though. Next slide. If you have any concerns about your flu shots, a few things that I definitely wanted to bring up. It is very important that we try and keep each and everyone around us healthy. And the best way to do that is to ensure that we're getting our flu shots each and every year. It's going to help reduce your risk of hospitalization and help ensure that the people around you don't get sick either. As Dr. Richardson mentioned earlier, previously there was issues with egg allergies, but that is no longer the case. If you have any other questions, there is a link at the bottom of the screen there for you. One thing I did want to mention is if you get your flu shot outside of the VA, by all means, we're happy that you got your flu shot, but your primary care team would absolutely love to hear that you did. Later in the year, my team is going to be reaching out to you to see if you got your shot and to help ensure that we're meeting those guidance and the guidance provided and ensuring that we're affording you every opportunity that you got your vaccination this year. Next slide. That's all I had for your flu shots. I'm happy to be a part of the Hines team. Next up, we have Justin Schmidt from pharmacy to talk about the Parkit prescription.
Hello and good evening. Earlier we heard a little bit about how the parking is improving here at the Hines VA. I'd also like to point out that through the pharmacy outpatient system, the parking system is improving as well. What do I mean by that? Prescriptions can now be parked in the outpatient pharmacy. And what that means is that when providers are entering new prescriptions or changing prescription orders, those prescriptions don't necessarily need to be sent to veterans. And this can be helpful when veterans already have a significant supply of a medication or when a veteran is still deciding if they want to take a medication. So having previously been a home-based primary care pharmacist and having gone on home visits, I know the situation that medication and supply stockpiles can be. So this is an excellent feature that can help reduce those stockpiles from building up and from veterans paying unnecessary copays. One nice thing about prescriptions that are parked is they can still be requested by the veteran through My Healthy Vet or their va.gov account. Next slide, please. And right now, we have about 1,100 prescriptions that are parked at the Hines VA. These are commonly for medications or classes of medication that are frequently changed. So you can think insulin, weight loss medications, blood pressure medications. The park feature has been adopted by providers. That adoption is steadily increasing, and we expect to continue to see it increase. So you may hear your provider refer to a prescription as being parked, and what that means is it's ready for you to request, but it's not coming to you until you request it. Next slide. And thank you. I'd like to, at this point, introduce Christina Morrow to present on veteran health education.
Hello, I'm Christina Morrow, and I'm presenting just a brief overview of our patient orientation. So our patient orientation occurs every second Thursday of every month in Building 1, room F157, and it's between 11 a.m. to 12 p.m. Next slide, please. So patient orientation is a one-time patient orientation class that will provide you with information about the many great resources and services we have available at Hines VA. You can learn about what social work does for you, how and when to contact your PAC team, best ways to refill your prescriptions, options for mental health services, how to apply for travel pay, and a lot more. So again, please consider joining patient orientation. Again, it's held on the second Thursday of every month at 11 a.m. Thank you. And now, Director Dolan for closing remarks.
Thank you. And thank you to all our presenters. A lot of great information. I have a couple more updates to share with everyone online. First, we're going to be having a Hines VA blood drive on October 11th. And as many of you know, there is a tremendous shortage of blood available in the Chicagoland area. So please, if able, consider donating blood. We're inviting all visitors and patients of Hines to donate Friday, October 10th. I'm sorry, I gave you the wrong date. From 9:30 a.m. to 1:45 p.m. It's going to be in our auditorium, which is Building 9 of our main campus. Walk-ins are welcome, however, appointments are very much preferred, so we can be as super organized as possible. To make an appointment, please call 1-800-786-4483, and more information can be found on your screen. A big exciting change here at Hines, which we're nearly a month into this journey and we're super proud of, is our food service for veterans. So we're doing any inpatient veteran, anyone in our CLC and our acute tower can now order food service by dialing the number 2 and then the letters that spell DINE, D-I-N-E, between the hours of 6 a.m. and 6 p.m. Veterans are allotted 3 meals and 3 snacks each day and can order what they want when they want it, as long as it's within their diet order, and they will happily bring it to you. Also happy to report Mr. Tumpus, who you heard from earlier, he and his team had a project on Tripp Avenue. They completed a portion of our steam pipe project, and I'm very happy to share that they finished the work ahead of the projected completion date. So thank you to Joe and his team. And then also, as a reminder, we've done this since long before I became the director here. Every Thursday, we have a food pantry for our veterans in need. We're continuing to do that from 10 a.m. to noon, again in our auditorium, every Thursday except the 5th Thursday or a holiday. So please, if you're in need, come to our food pantry. And lastly, I want to share, as we're now in October, the holidays are just around the corner, and to celebrate, we're inviting all our veterans to attend what we're calling Merry Pawmas on November 15th. So bring your furry family member to have a photo taken with Santa Paws and celebrate the holidays with us. More information can be found on your screen. Thank you for all you do for us. Thank you for your service. Please, if you have any questions, message us or put it in the chat. We'll get back to you as soon as possible. And we look forward to providing additional information and updates at our next Veteran Town Hall on December 10th. Thank you, everyone, and be safe.